Welcome back to Family Health Today. I'm Dr. Jeanette Neshwat. Last month, the U.S. Preventative Services Task Force, or USPSTF, released new recommendations for breast cancer screening, which clashed with the recommendations made by the American Cancer Society. The news came amidst heated healthcare debates in Washington, and they were received with confusion and outrage. Here to help us understand exactly what the recommendations are and how they differ from previous guidelines are Robin Hall Guadagnini, a breast cancer survivor and advocate for preventative medicine, and Dr. Stacy Smith-Foley, a radiologist at the Breast Center in Fayetteville. Welcome.
Thank you.
Thank you both for being here.
Thank
We
you.
appreciate it. Now, Dr. Stacy Smith-Foley, tell us, what is the USPSTF and why are they making these changes?
Well, they are a consortium, an independent coalition of primary care and preventative physicians who make recommendations based on evidence regarding preventative healthcare services.
Okay, and what are these major changes that they're making recently that's making headlines in the news?
Well, most recently, they've recommended that women under the age of 50 not have mammograms, and that women over 50 receive mammograms every 2 years instead of every year, and women beyond the age of 75 that they don't need mammograms at all anymore.
How do you think that this affects all of us in general as a whole?
Well, I fear that this will set back the advances that we've made regarding breast cancer more than 20 years. The reason that we have been able to decrease the morbidity and mortality related to breast cancer is because women have been getting annual screening mammograms, and that affords us the ability to detect cancers at an earlier stage and size, making treatment much easier on patients.
Absolutely. Now, Robin, you were diagnosed in an off year. Tell us about that. What does that mean, an off year?
At the time I was diagnosed, I was 40, actually I was 41, going to turn 42, and at that point the recommendations were at 40 to have every other year. I was that other year, so it would be the same as what they're saying now with 50 at every other year. I was that mid-year that technically was not considered a year that should be screened. But I believe in preventive medicine, so I went in and had an annual mammogram as normal, whether or not it was recommended or not. And that's when they found my cancer.
Now, did you have a family history, or were you just
No.
following the guidelines that were already out and recommended to you by your physician?
I was following what was recommended by my physician, and I knew enough people throughout life that had breast cancer that didn't fit those guidelines. It's not in my family. I had no history of it at all, and I just prefer preventative health care, and so I decided it was important enough to do that.
And how did you pay for your mammogram?
Out of my own pocket.
Out of your own pocket. Wow. How do these recommendations affect women with health insurance and without?
Well, for women who are insured, it may prevent them from getting mammograms. If the insurance companies adopt these recommendations, they may no longer pay for annual mammograms for all women, and they may not pay for mammograms for women under 50 or women over 75.
I see. What does the average cost of a mammogram run usually, Dr. Smith-Foley?
It's approximately $200, which in the scheme of life is not that expensive.
Absolutely, especially when prolonging your life for many more years to come. Now, I've heard, many issues, many arguments that mammograms are painful, they're not cost-effective, there's a lot of false positives. What are your thoughts on that?
Well, they're not that painful. It all depends on your perspective. Mammograms are relatively painless. They are non-invasive, and the amount of radiation that we use to obtain a mammogram is very low, so the risk from getting a mammogram is very low. The benefit is high. We're able to detect cancers that patients aren't able to feel, and when we detect cancers at a smaller size or an earlier stage, they're more treatable.
I see. What's the difference between a mammogram and a digital mammogram?
Well, a digital mammogram takes the picture digitally instead of using a film and a screen. And digital mammograms detect breast cancer better in women who are under 50, women who are pre- or perimenopausal, and women who have heterogeneously dense breast tissue. So the task force is recommending that we're not able to detect breast cancer very well in women under 50, but digital mammograms improve our ability to detect breast cancer in women under 50.
Do you know, is there a major difference in cost between a regular mammogram and a digital mammogram?
There's no difference in cost.
Excellent. And I understand if you didn't have a digital mammogram, your breast cancer may not have been picked up. Is that correct?
That's correct. I was, of course, I was in my 40s, early 40s, very dense breasts, no history in my family, so I fit all these parameters that probably most people wouldn't look. You couldn't feel it. I couldn't feel it. The physicians couldn't feel it. And they at the breast center were able to see with the digital mammogram that there was a spot that did not look right, and they said that it was, it was breast cancer. But the thing I think holds true to me so much on that is that they told me at the time that it was not a death sentence, and it really isn't if it's caught early, which is the key for keeping mammograms going for people who are young.
Do you think MRIs are going to replace mammograms, or are they used as a further diagnostic tool?
Well, breast MRI is a very useful tool in evaluating the breast, but it's an expensive tool and it's not appropriate for all women. For women who are at a very high risk for developing breast cancer, such as women who have a known BRCA1 or 2 mutation or have a known mutation in their family, it is appropriate for those women to have an MRI in addition to their mammogram. But it is a more lengthy test, and that technology isn't readily available throughout our country, whereas mammograms are.
And probably more expensive as well.
It is on at least 10 times more expensive.
I see. Now, the new recommendations are also discouraging self-breast exams that currently, previously they were recommended once a month, after your period, usually the same time each month. Now that's changing as well. Tell us about that.
Well, the task force is recommending that women not examine their breasts themselves because they say that women find too many lumps that aren't important, and they're also recommending that physicians not examine a woman's breast either. I find those recommendations ludicrous because on a day-to-day basis, I see patients that find their own breast cancer well before their physician ever would find their breast cancer or before a mammogram would detect their breast cancer.
And it only takes a few minutes, that's as well, doesn't it?
It does. It takes a few minutes of your time, and every woman should know their body. Every woman knows their body better than anyone else does.
I agree with that. Now, Robin, tell us about your work on Capitol Hill and your involvement with Right Here, or Right Scan Right Now.
I was asked at the breast center, they had a press conference here to get the word out, just that there were some cuts being proposed with the health care plan, and one of the major cuts was to medical imaging. And so getting involved locally, then I was asked to come to Washington, D.C. and tell my story, basically, just that how important medical imaging is, and that as a breast cancer survivor, I wouldn't be here today had they not performed the mammogram that they did because my breast cancer was caught so early. And just the importance of knowing that the right scan at the right time stays accessible for all people.
So in a sense, you're a spokesperson, for women's health care and breast exams and getting your mammograms. Do you think that women are now understanding the gravity and the importance of women's health care and getting mammograms and breast exams?
I hope they do. I feel like with the results that came out with this task force, that hopefully they will understand. My fear when they first came out was that people would just go, "Oh, good, I don't have to do anything till I'm 50." But I think with all the discussion that's gone on with people like you getting the word out, that it's helped to make it clear how important it is to take care of ourselves, to take care of our bodies, to take care of getting mammograms, of screenings, and of doing the things that will keep us for a long and healthy and happy life.
Excellent. And Dr. Smith-Foley, do you have any last-minute words of wisdom or recommendations that you'd like to share with our viewers?
Well, I would still encourage women to get annual screening mammograms. That is the recommendation that the American Cancer Society and the American College of Radiology, as well as the American College of Gynecologists, continue to recommend that women age 40 and over get annual screening mammograms. I would also encourage women to do monthly self-breast exams and to see their doctor every year for a clinical breast exam.
Excellent advice and information.